Well, hello, this is Erika Hood again, the Program Development Manager at the Center for Reducing Health Disparities at Metro Health Medical Center. And today I am joined by Gulnar Feerasta from the LGBT Community Center of Greater Cleveland. Thank you so much for joining me today.
It's a pleasure to be with you today. Thank you for having me.
No problem. We think it is extremely important during this time to connect with some of our community partners who are doing fabulous work. And while we're all kind of in a state of change and a constant, transition and making adjustments right now during this COVID-19 crisis, we wanted to connect with our community partners to see how you guys are adjusting and what some needs may be. So we'll just dive right in. Can you tell us a little bit about the center and what you guys do there?
Sure. So the center really serves as the hub, the connector for the LGBT community of Greater Cleveland, but also Northeast Ohio in general. And our mission really is to enrich the lives of Cleveland's diverse LGBT community through advocacy, through education, celebration, and support. And so that's what we are trying to do the best that we can through these uncertain, tumultuous times. It's been quite a shift to do that more virtually than we have been doing in the past, which is more doing that in person through person-to-person programming. It's been quite a change to do that virtually and shift the way that we do things.
Yeah, I can imagine. It's been a very trying 6 weeks or so. It seems like so much has changed in this time frame. What types of services do you all offer?
So we offer what we call core programs. So these are programs that we would fall under direct services to folks. We have a program called SAGE, which serves our LGBTQ elders who are mature adults, 50 plus. And so that meets 3 times a week, Monday, Wednesday, Friday in the mornings from about 10:30 to 11:30, 12 o'clock, and then we usually serve a hot meal. There's all sorts of health and wellness activities that are incorporated. So Mondays we have Tai Chi, then on Wednesdays we have some sort of joint mobility exercises, and then Fridays we have chair yoga, and then on Wednesdays after lunch we would have our therapy. And then we also offer our youth program, which is for youth who are 11 to 20 years old. It's called QU, and it has 2 different components. One is more of a drop-in center where youth can just come in, hang out. And then for youth that are interested more in leadership development, we have a leadership institute, which is called Power Up, Power Out, and they can learn all sorts of skills around organizing, pushing for social change, grassroots networking, advocacy, etc. And so both of these run simultaneously. We have group check-in that goes from about 4:30 to 5:30, and then the groups would usually split off, and then we have a community style meal once a week. And then we also have a trans wellness program that is Mondays and Wednesdays, and this is for anybody who's 18 and up, who identifies as trans, non-binary, gender fluid, gender queer, that entire spectrum of different expressions of identity. And so they meet from 3 to 7:30 Mondays and Wednesdays. And then on Wednesdays, they would also have art therapy. So we have been successful in shifting all our programming to a virtual platform. We've had to adjust some of the components in terms of, art therapy is hands-on, can't really translate that into a virtual platform. So we're looking at different modalities of healing art that we can do virtually. Some of our wellness components we're looking at different ways of offering them to the wider community instead of just making them specifically for our particular program audiences. Um, and then we also serve the wider community. So we have a lot of community affinity groups that would meet at the center, like a bi-plus group, a men's group, Transcend, which is a a non-binary group that would meet at the center once a week. But it was more of a social activity group. We have Out Proud and Pagan, a whole host of different groups, Spectrum Saturdays, which was a group for trans identifying folks that are on the autism spectrum, trans family. So all of these groups, we have reached out and offered them the option of supporting them if they would like to meet virtually on the center's virtual platforms. And majority of them have asked to do that, so we've gone ahead and helped set that up. Some prefer to keep it more private and do it themselves, which is also fine. We just make sure that we can help them communicate that. So we have our community groups, we have our core programs. We also offer other wellness services with the Metro Health Pride Clinic being on site once a week. We also offer HIV testing. So right before COVID happened, which we all internally refer to jokingly, because you got to have some sort of humor in this, is the world ended. The zombie apocalypse. We had gotten to a point that we were able to offer testing thanks to our wonderful, amazing community partners. 5 days a week. Wow. Which was really awesome to be able to offer that. So we were able to offer HIV testing and do referrals for continuum of care, get people connected to PrEP. We offer HIV education, STI prevention, PrEP education, but also every month on the last Monday of the month with our partners at Metro Health PrEP on Demand Clinic, we were having the clinic on site so people could get their PrEP on Demand prescriptions. So that was really great. And then we also do, healthcare referrals to mental health. And then we collaborate a lot with our partner universities. Northeast Ohio, especially in Cleveland, is very lucky to have some really great universities and institutions of higher learning like Case Western Reserve University, CSU, and Baldwin Wallace, CU. So we work a lot with them collaboratively on different research projects that to do, because there's not a huge body of research on the queer community, and so we do our best to facilitate that, because there should be research and data on the LGBTQ community, and we want to make sure that we are part of that a gathering of that information, but that information is also then available to the queer community for us to be able to address the disparities that come to light through that information.
Absolutely. You're right. Absolutely. It's research being done from this end of the spectrum to that. So make sure it encompasses all groups of people. And, we have to address those disparity issues that exist as well. So that is so true. So it seems like you guys have made an adjustment to use virtual platforms to try to keep your core programming running, and then as well as offer that support for your community groups. How do you address food and, like meals, if people were dependent on the meals, or, are folks in your core program engaging on the virtual platforms? Like, do you see a lot of attendance?
Yeah. So, so there's several ways. So we do a lot of outreach. I would say like the one way that things have really changed for us is we're really good at outreach in our community and building those relationships and that rapport, that relationship of trust in our community. And so this has really been an opportunity for us to get even better at that and improve the way we do that, and become more hands-on at that. So not only are we doing programming, and making all the adjustments to build that infrastructure internally, and so we've done what we can with the limited infrastructure and resources that we have and the capacity that we have, but all our program coordinators are also doing extensive outreach, making phone calls. For example, our SAGE coordinator spent 25 hours last week just making phone calls to folks in our SAGE program, to check in. We've had a great response from our volunteers. We have an amazing volunteer program, led by our community engagement and volunteer coordinator, and we put the word out. We had a great response from our community partners. Within 24 to 48 hours, we were able to get 25 volunteers onboarded, trained, and to volunteer their time to make phone calls to our elders.
Wow.
At least once a week, some more than once a week for those that were interested, of our elder group, to alleviate some of that social isolation that they feel. LGBTQ folk, we already feel a little bit isolated anyway, just because of the disparities that we experience, the marginalization that we experience, and this the social distancing has exacerbated that.
Yeah.
And so we're doing what we can to make sure that we're doing that outreach one-on-one. And so while that outreach is happening, that's how we're identifying also folks that need food assistance, that are struggling with housing insecurity,
Okay.
that need assistance with getting to medical appointments, even though most of it is telehealth, but there are some folks that need to get to the doctor to get their HRT.
Right.
That need to get to the health clinic for medically necessary treatment,
Okay.
and are unable because they don't have transportation and they can't get on the bus, and things like that. We've seen an uptick in requests for referrals for mental health. A lot more folks are definitely expressing that they're feeling more anxious, feeling more lonely. A lot of symptoms of anxiety and depression. And that of course is a um, a result of the social distancing and the isolation that folks are experiencing. Um,
Absolutely.
and then, so those are our guests or members of our community, but we're also doing our outreach to our community partners, the organizations that we serve. We have a really great education and advocacy coordinator who does our trainings and our workshops out in the community. And I know that right now, a lot of organizations are not able to continue to do their trainings. So what we've done with John Licatatizo, if you go to our Facebook or our website, you'll see quick tips from John the trainer, and he's putting out these little videos around like, hey, how do you stay engaged, and how do you support your LGBTQ folk that are working for you, or the census is coming up, right? And so it's a way to keep our community engaged as well, and to remember that we count, we matter, we're visible. So let's, as a community, continue to stay engaged and advocate for ourselves in these very important civic issues.
That's awesome. Are you still looking for volunteers?
Yes, we're always looking for volunteers for different things. So we are getting ready to launch different uh, uh, things internally. We're looking at ways to continue to engage virtually in terms of how can we do more to engage folks in the community who are maybe writers
Mhm.
or who are more creative.
Mhm.
And so, if there are volunteers who are really interested in getting connected and helping us out with keeping up with the things that are happening legislatively and helping
Yeah.
us draft advocacy briefs and
Mhm.
things like that, we would love to hear from you. If there are folks that are comfortable with making grocery runs and delivering groceries, we'd love to hear from you. Because Instacart these days has like a week-long
Like it does. Everyone is using those platforms. Yeah.
yeah.
Okay.
Um, so things like that. And then, once Governor DeWine has issued, his guidelines for the gradual reopening. And so if and when we do reopen, there, we probably won't look at immediately doing in-person programming because of the limitations around like 10 people in a gathering and whatnot. But we'll still want to continue to help people with providing food assistance and access to essentials like hygiene kits and things like that. So we'll probably still need help with coordinating some of that, making those runs and putting together the bags and things like
Yeah.
that.
How can
Uh,
we get in contact with you guys?
they can always go to our website,
Okay.
www.lgbtcleveland.org.
Okay.
All our phone numbers are on there. They can go to our Facebook and send us a direct message.
Okay.
We respond really fast. You can even submit a web query and you'll receive a response within 24 to 48 hours.
Okay. That's good to know. See, I think a lot of times we may not know the needs of some of our community partners, and that's like huge. And it also isn't just folks to donate money or items, but expertise. And I think that that's huge. If folks can lend a helping hand to try to get some things off the ground for you guys, that's awesome. I was thinking
Yeah.
about Pride, and I'm like, what is that going to look like, this year? And I know you guys are probably thinking about it too. So future programming, we talked about maybe the center opening up with this gradual reopening, but have you guys thought that far yet? Have you?
Yes, we are definitely having internal discussions about that.
Mhm.
So we did put out a message around a redate because Pride was going to happen in June.
Right.
However, so our redate is in September,
Okay. Okay.
but again, subject to the changing guidelines. We
Right.
don't know
Right. We
what
don't
that's
know.
going to look like. And so far it's still in September 12th, I believe was the redate. But keep an eye out for our updates and any messaging from the center around Pride. Our website is most up to date. We have right there on the front page COVID-19 updates. So you'll get all our updates, all our resources. Everything that I've mentioned here is also on that resources page. And of course, your monetary donations help us a lot because it helps us to keep the capacity going to continue to provide these services, to help us build up our infrastructure, to do things like offer maybe like virtual training to organizations, or to continue to do outreach and things like that. We're doing street outreach, providing sex kits and hygiene kits and making those food deliveries to folks that are still working.
Mhm.
So, yeah.
And to those participants in the SAGE program and the QU, like, what do you want to tell them? If you can leave a message for everyone that you're missing, and what do you want to tell them during this time to stay encouraged?
I would say that we are in it together. You are never far from our thoughts. We are here for you. If you need us, please reach out.
Mhm.
Don't be afraid to reach out. Don't be afraid to let us know if you need anything. We will continue to do our best to make sure that we can help you. If we cannot help you, we will make sure that we connect you to the right people to make sure that you get the assistance and the resources and supports that you need. You know, this has really opened my eyes, even more to the fact that we don't just serve Greater Cleveland. We've gotten youth in our program from places like Ashtabula and Geauga, folks that, you know, Canton,
Yeah.
folks that have never been able to come to the center, but are now finding that the center is all of a sudden accessible to them through our virtual programs. So we definitely want to keep that virtual component going even past COVID. And so just know that we're here. We're thinking of you constantly, trying to find ways to keep this going even past this pandemic. But sending you lots of love, lots of good juju and good energy.
Right.
Always here for you.
Gulnar, thank you so much. This was a great, great resource, and we'll post it and we'll share it. And we hope that those who need to see it, and also those who can help, will get in contact with you all. This was great. I thank you so much for sharing.
Thank you so much for having me. Thank you so much for helping us get the word out about our organization and the work that we do, and helping us reach folks who may not know that we're here and need us.
Yep.
So thank you.
Thank you.